So today we are going to talk about the aneurysm. What is an aneurysm? So an aneurysm is an abnormal swelling or bulge in the wall of a blood vessel, such as an artery. So aneurysms can occur anywhere throughout the circulatory system, but most commonly it is developed along the aorta. It is the body's main artery that runs the length of the trunk and in blood vessels of the brain. So yung aneurysm po, ito yung umbok sa ugat sa kahit anong parte ng katawan. Pwede sa legs, kidney, at saka sa utak. Pero ang pinakamadalas na natatamaan ay yung aorta. So yung aorta po, yung pinakamalaking ugat sa katawan. Galing ito sa puso at dumadaan ito pababa hanggang sa tiyan. So kung titingnan natin yung normal na ugat, may 3 layers ang wall nito, which is yung tunica adventitia, tunica media, and then the tunica intima. So kung ikukumpara natin sa aneurysm, may parte sa ugat na mahina at manipis na yung 3 layers na yon. So kapag dumadaloy po yung dugo, nag-stretch yun, which creates the aneurysm or yung tinatawag nating umbok. So, nabubuo po yung aneurysm due to stress sa blood vessels. So, para po siyang lobo na habang lumalaki, nagninipis yung ugat, then nagpo-form siya na parang balloon, and yun na po yung pumuputok. So, yung aneurysm nga is yung distension at site of a weakness in an arterial wall. So, may iba't iba po tayong type ng aneurysm, and the first one is the saccular aneurysm. It is the pouch-like projection on one side of the artery. So, kapag nasa one side lang ng ugat yung umbok, ito po yung tinatawag nating saccular aneurysm. Mukha itong berries, and sila yung most common type ng aneurysm. Meron siyang neck that connects the aneurysm to its main parent. So, the next one is the fusiform aneurysm. So, entire circumference of arterial wall is dilated. So, yung fusiform aneurysm naman po, kapag lahat ng size ng ugat ay lumobo. So, ito na yung tinatawag nating fusiform. The next one is the mycotic aneurysm. Dito po sa mycotic aneurysm, ito yung infection sa vessel wall which can be bacterial, fungal, viral in origin. So, they are a rare but severe complication of systemic infection and atherosclerosis. So, the next one is the dissecting aneurysm. So, it is the tear in the lining of an arteriosclerosis aortic wall. Causes blood to form a hematoma between layers of the artery compressing the lumen. So, dito naman po sa dissecting aneurysm, yung part ng wall of the aorta which is yung tunica media, nag-split siya into 2 layer na nagka-create ng false lumen sa wall. So, entry of blood can occlude branches of the aorta at that site. The thoracic aorta is the most common artery na affected sa ganitong process. So, symptoms of an aneurysm. So, an aneurysm may have no symptoms or asymptomatic until it is either very large or it ruptures. So, yung symptoms depends on which blood vessel is affected. So, ano nga ba po yung mga sanhi ng pagkahina at pagkanipis ng mga walls ng ugat? So, maaari pong meron tayong mataas na cholesterol sa dugo, mataas na presyon, paninigarilyo, at may naman ng sakit tulad po ng Marfan syndrome na sumisira sa collagen kaya numinipis ang walls ng ugat. So, another one is yung pamamaga sa walls ng ugat na dulot ng infection na hindi naagapan kaagad. So, tulad po ng syphilis, which is isang uri ng sexually transmitted disease, and then the tuberculosis, and then the salmonella. So, yung sintomas din po ng aneurysm is nakadepende sa size at saka sa location nito. So, madalas wala talaga itong sintomas. Kapag malaki po yung aneurysm, may mga more than 6 cm at saka yung location niya is nasa bandang taas ng aorta. So, maaring maipit yung daanan ng hangin at esophagus na nasa likod nito. So, yung pasyente natin is pwede siyang makaranas ng hirap sa paglunok and then hirap din siya sa paghinga. So the next one is the types of aneurysm. So the next one is the cerebral aneurysm. A cerebral aneurysm occurs in a blood vessel in the brain. An aneurysm in the brain has no relationship to other aneurysms in the body, but in a small number of people, there is a family history. So cerebral aneurysms are more common over the age of 60. Symptoms of a ruptured cerebral aneurysms include several headache with rapid onset, neck pain and stiffness, increasing drowsiness, paralysis, seizures, impaired speech, and visual problems. An unruptured cerebral aneurysm may have no symptoms related to it at all and may be discovered incidentally. So the next one is the thoracic aortic aneurysm. A thoracic aortic aneurysm affects the aorta in the chest. So symptoms of a ruptured thoracic aortic aneurysm include pain in the chest, back, and neck, coughing, breathlessness, swallowing difficulties, hoarseness of the voice, swelling of the arms, and a constricted pupil and dropping of the eyelid affecting one eye. So in the subjective data, it may be asymptomatic. So dyspnea, dysphagia, pain resulting from pressure against nerves or vertebrae. When it comes to the objective data, the hoarseness, cough, and aponia from impingement on laryngeal nerves, and then the unequal pulses and arterial pressure in upper extremities. So the trachea may be displaced from midline because of the adhesions between the trachea and then the aneurysm. So, yung dyspnea po is yung shortness of breath, dysphagia is the swallowing difficulties, and then the aponia is the loss of ability to speak through disease or may damage siya sa larynx or sa mouth. So dito sa picture makikita natin yung thoracic aortic aneurysm. So the healthy thoracic aorta, this is how it looks like. And then the thoracic aorta with aneurysm. So ayan po, makikita natin yung difference. So the next type po is the abdominal aortic aneurysm. So an abdominal aortic aneurysm affects the aorta in the abdomen. So symptoms include pain in the lower back, abdominal swelling, nausea, vomiting, rapid heart rate or the tachycardia, sweating, and the sensation of a pulse in the abdomen. So kapag ang aneurysm po ay nasa may bandang baba ng aorta sa may tiyan, may makakapa po yung doktor na bukol na pumipintig. So kapag ikaw mismo napansin mo na may ganito ka, huwag mo na pong pisilin kasi pwedeng pumutok yung aneurysm. So when it comes to the subjective data po, it may be asymptomatic, so lower back or abdominal pain, which may be severe if the aneurysm is leaking. So sensory changes in lower extremities if aneurysm ruptures. And then the objective data, so meron siyang hypertension, pulsating abdominal mass, mottling of lower extremities, and increased abdominal girth if aneurysm ruptures. So in this picture po, makikita po natin yung pagkakaiba ng healthy abdominal aorta sa abdominal aorta with aneurysm. So ganito po yung hitsura nila. So the causes of aneurysm is, the first one is the weakness in blood vessel wall that is present from birth, which is the congenital aneurysm, the high blood pressure or the hypertension over many years resulting in damage and weakening of blood vessels, the fatty plaques or the atherosclerosis, resulting in a weakness of the blood vessel wall. Next one is the inherited diseases that may result in weaker than normal blood vessel walls. Then trauma such as a crush injury to the chest, so the sexually transmitted infection which can be syphilis if untreated, so it targets the aorta and weakening its walls. The polycystic kidney disease, increasing the risk of cerebral aneurysm. And lastly is the very occasionally an infection targeting and weakening a section of blood vessels. Complications with aneurysm. So, blood clots within the aneurysm. Nagkakaroon din ng compression of nearby nerves. So, kapag sobrang laki ng aneurysm, nagkakaroon din ng blood leaking out of the intact aneurysm into the walls of the artery, which is what we call the dissecting aneurysm. Then, the impaired blood circulation beyond the point of the aneurysm, the hemorrhage in the layers of the tissue surrounding the brain, which is the subarachnoid hemorrhage. Then, the next one is the water on the brain or the hydrocephalus. Then, the stroke. So, kapag meron po tayong brain aneurysm, pwede siyang mag-leak or rupture that will cause bleeding into the brain. So, ito yung tinatawag nating hemorrhagic stroke. Kadalasan nangyayari siya between the brain and the thin tissues covering the brain. So, the next one is the paralysis, congestive heart failure, heart attack, kidney failure, and then worse is the sudden death. So, the diagnostic procedures are the physical examination, x-rays, the ultrasound scans, the computed tomography or the CT scans, or the CT angiograms. The next one is the magnetic resonance imaging or the MRI or the MR angiograms. And then the digital subtraction angiograms. And lastly is the examination of the cerebrospinal fluid for the diagnosis of a subarachnoid hemorrhage. So, the treatment for cerebral aneurysm, so it is repaired either by coils or stent insertion or by surgery where the aneurysm has been clipped. So, if the aneurysm has ruptured, then you will need to stay in hospital for up to 21 days because of potential complications. So, it includes the vasospasm and the hydrocephalus. So, around 1/3 of all people who experience ruptured cerebral aneurysms die unless. So, these pictures are the treatment or the surgical treatment done with aneurysm. So, mapapaliwanag pa po yan sa next slide. So, the thoracic aortic aneurysms requires drugs to control high blood pressure and surgery to repair the aneurysm if necessary. And sometimes the nearby heart valve may also need fixing during the operation. So most people with ruptured thoracic aortic aneurysm die within minutes. So these pictures shows the normal aorta. The second picture is the aorta with aneurysm. And then the last pictures shows the after surgery. So, there is a tube graft repair. So, if the aneurysm involves the ascending aorta, which is located in the part of the aorta that exceeds the heart and travels up toward the neck, the diseased portion can be replaced with a tube graft through an incision on the front of the chest. So, this is called a median sternotomy and extends down the front of your chest through your breastbone or sternum. So, this enables your cardiothoracic surgeon to see your heart and aorta. The next one is the abdominal aortic aneurysm. So it requires drugs to control a high blood pressure and surgery to repair the aneurysm if necessary. So the mortality rate is more than 50% if the aneurysm ruptures. So the first picture shows the open surgery for an abdominal aortic aneurysm, which is called open AAA repair. The affected segment of the aorta is replaced with a material graft stitch in place. So the second pictures shows the endovascular AAA repair, which is called EVAR. A stent graft is placed inside the aneurysm to reline the aorta and prevent the aneurysm from bursting. So dito, pinapakita po yung iba't ibang uri ng treatment para sa aneurysm. So, para sa minimally invasive endovascular surgery, ginagamitan po ito ng stenting at saka coiling. And para naman po sa open brain surgery, ginagamitan ito ng clipping. For the surgical treatment, if the aortic aneurysm is less than 5 cm wide, it is usually left untreated but closely monitored kung sakali pong lumaki pa yung aneurysm. If it is larger than 5 cm, the aneurysm is surgically repaired. In most cases po, the aneurysm is cut out and the hole is plunged with an artificial graft. So, depending on the location of the cerebral aneurysm, it will be treated either surgically with clipping or by using fine platinum coils inserted in the aneurysm via an angiogram, which is a radiological procedure that is used to close the aneurysm and to preserve the normal flow of blood in the brain. So when it comes to the assessment or the analysis, so we need to know if the patient has any history of risk factors, pulsation in abdomen. So if meron man po, kailangan natin siyang i-palpate gently. Then the severe back or abdominal pain. So this may indicate impending rupture, and then we need to assess the peripheral neurovascular status. Dito naman po sa planning or implementation, kailangan po nating i-monitor yung neurovascular status of extremities, which is yung ginagawa natin para ma-evaluate natin yung sensory at saka yung motor function. So, this includes the pulses, capillary refill, the skin color, temperature, sensation, at saka po yung motor function. Kailangan din po nating i-monitor yung kanyang hemodynamic status, vital signs, and then the oxygen saturation, and then the ECG. Yung hemodynamic status, ito po yung ina-assess natin kung stable pa ba yung pagpump ng heart at kung merong good circulation of blood sa katawan. So, kailangan din po nating i-record yung input at saka output dahil maari pong magkaroon ng acute renal failure pagkatapos ng surgery. Administer prescribe opioids to alleviate pain. Apply abdominal binder to provide support when client is coughing, deep breathing, and ambulating. So, prevent flexion of hip and knees to eliminate the pressure on arterial wall. Evaluation or outcomes. So, we should maintain adequate peripheral circulation and then makes lifestyle changes para ma-modify po natin yung risk factors. So, the next topic is about shock. The term shock may refer to a psychologic or a psychologic type of shock. Psychologic shock is caused by a traumatic event and is also known as acute stress disorder. So, this type of shock causes a strong emotional response and may cause physical responses as well. So, yung shock ko, nag-cause po siya ng low blood pressure which could be due to low cardiac output or a low systemic vascular resistance. When it comes to the subjective data, nagkakaroon po ng apprehension, which is yung anticipatory fear or yung tinatawag nating anxiety, the restlessness, the paralysis of extremities, which is yung condition wherein yung muscle movement has become weakened or impaired. Para siyang mild paralysis or partial paralysis, nangyayari siya due to nerve damage. The objective data, weak, rapid or tardy pulse, diaphoresis, cold clammy skin, pallor, decreased urine output, nagkakaroon din po ng progressive loss of consciousness, decreased mean arterial pressure, which is the normal is 80 to 120 mmHg. So we have 4 types of shock. The first one is the obstructive shock. Second one is the cardiogenic shock. The third one is the distributive. And the last is the hypovolemic shock. Dito po sa obstructive shock, nangyayari siya when the blood can't get where it needs to go. A pulmonary embolism is one condition that may cause an interruption to blood flow. Conditions that can cause a buildup of air or fluid in the chest cavity can also lead to obstructive shock. So there is an internal or external obstruction that is affecting the blood flow out of the heart or into the actual grave vessels. So, nagkakaroon po ng collapse lung or yung pneumothorax. Hemothorax or yung blood collects in the space between the chest wall and lung. Cardiac tamponade, the blood or fluid fill the space between the sac that surrounds the heart and the heart muscles. Dito naman po sa cardiogenic shock, damage to your heart can decrease the blood flow to your body, leading to cardiogenic shock. Common cause po nito ay nagkakaroon ng damage sa iyong heart muscle, irregular heart rhythm, very slow heart rhythm. So, dito po sa cardiogenic shock, the heart is not being able to generate a certain amount of power or the pump is failing. Nagkakaroon po ng decreased volume of blood. That means you are having a systemic hypotension, which will lead to low blood pressure and low cardiac output. So, magkakaroon din po ng insufficient supply of oxygen. And kapag tumagal po yung ganitong sitwasyon, it will lead to organ failure. Distributive shock. Conditions that cause your blood vessels to lose their tone can cause distributive shock. When your blood vessels lose their tone, they can become so open and fluffy that not enough blood pressure supplies your organs. So, distributive shock can result in symptoms including flushing, low blood pressure, loss of consciousness. So, dito po sa distributive shock, nagre-result po ito from excessive vasodilation and then the impaired distribution of blood flow. The septic shock is the most common form of distributive shock.
Types of distributive shock. Anaphylactic shock is a complication of a severe allergic reaction known as anaphylaxis. Allergic reactions occur when your body mistakenly treats a harmless substance as harmful. This triggers a dangerous immune response. So, anaphylaxis is usually caused by allergic reactions to food, insect venom, medications, or latex. Septic shock is another form of distributive shock. Sepsis, also known as blood poisoning, is a condition caused by infections that leads to bacteria entering your bloodstream. Septic shock occurs when bacteria and their toxins cause serious damage to your tissues or organs in your body. Yung septic shock po ang nagkakos ng reduce diastolic blood pressure, widen pulse pressure, which results to flush or warm extremities. So ito po yung most common site of infection. In decreasing order of frequency includes the chest, abdomen, and genitourinary tract. So commonly caused by bacteria, although viruses, fungi, and parasites. Neurogenic shock is caused by damage to central nervous system, usually a spinal cord injury. This causes blood vessels to dilate and the skin may feel warm and flush. The heart rate slows and the blood pressure drops very low. Hypovolemic shock. So this happens when there isn't enough blood in your blood vessels to carry oxygen to your organs. This can be caused by severe blood loss, for example, from injuries. Your blood delivers oxygen and vital nutrients to your organs. If you lose too much blood, your organs can't function properly. Serious dehydration can also cause this type of shock. So yung hypovolemic shock po, ito po yung medical or surgical condition in which nagkakaroon po ng rapid fluid loss result in multiple organ failure due to inadequate circulating volume and subsequent inadequate perfusion. So this can be caused by severe blood loss or non-blood fluid loss. For example po is yung severe third-degree burn, excessive vomiting, bowel obstruction, and diabetic ketoacidosis.
Nursing care of clients in shock. When it comes to the assessment or analysis, we need to assess the patient if the patient has any history of causative and risk factors, the fluid input and output over previous 24 hours. We also need to assess the signs of covert bleeding, which is the rapid ready pulse, hypotension, increased respirations, cold, and clammy skin. We also need to assess the mental status changes, which is the restlessness and confusions that leads to a lethargy and decreased level of consciousness. We also need to assess the cardiovascular status using ECG, hemodynamic monitoring, and peripheral vascular assessment. We also need to assess the respiratory status, the breath sound, the ABG, and the oxygen saturation. When it comes to planning and implementation, we need to keep the patient warm and place in supine position, monitor hemodynamic status and vital signs, monitor urine output and specific gravity, allay anxiety, which means we need to stop them from feeling afraid or doubtful, administer intravenous fluids and titrate parenteral vasoactive medications as prescribed, monitor oxygen saturation, and provide oxygen therapy as indicated. When it comes to the evaluation or outcomes, the patient should maintain stable hemodynamic status, maintains urine output greater than 30 ml per hour, remains oriented to time, place, and person, and maintains adequate cardiac output. The diagnostic test for shock is ultrasound, X-ray, CT scan, and MRI scan. That's all for today. Thank you. I hope you learn a lot.